Hey everybody, in today's episode, it's myself, Ben, and Dr. Jordan Zabriskie. Jordan comes on the show today to discuss the topic of proper movement, proper exercise, nutrition, especially for people that are recovering from drug addiction and alcoholism. We cover a ton in this episode. I do want to tell you, though, at the end, we do cut it short because I did have a family emergency, so we were not able to properly end the episode. But the episode's about 50 minutes long, and we were just winding down, so the bulk of the content is there. We cover so much. It's a lot of good information. Enjoy the show. Here we are, Real Recovery Talk. I am your host, Tom Conrad. In today's episode, we've got Benjamin B.
What's happening, everyone?
And we got Dr. Z.
Hello, everybody.
Also known as Dr. Jordan, right?
Yep.
Where can people find you on Instagram? Let's just start there.
On Instagram, you can find me on @painfree_lifestyle. And it's lovely. You guys should check that out.
@painfree_lifestyle.
Yep.
All right. First things first. Thank you for tuning in on the podcast app, whichever one that you choose to use. And thank you for watching on YouTube. In the end, if you have any comments, questions, or concerns, you could always reach us. info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message, right, peeps?
Yes, sir.
Whew. Also, go to realrecoverytalk.com. On the homepage, you're going to see a little link. It says schedule a call. Click that, and you can schedule a free 10-minute call with either myself, Ben, or Dr. Tambini, and we can hear about your current situation and see if we can assist you in any way, whatever you're going through. Also, go to realrecoverytalk.com/guides with an S, GUIDES. There you're going to find our catalog of guides. All you have to do is put your email in and click download. It's going to come right to your inbox, and you can print it out and hang it on your refrigerator. The key is actually doing what the guide says that you need to do. So go to realrecoverytalk.com/guides to get that. Go to Facebook and join our Facebook group. Ben, what's our Facebook called?
The Sobriety Network.
The Sobriety Network. Go there, go to Facebook, type in the Sobriety Network and click join. Just answer a couple of simple questions and we'll let you in. It's a community for people that are dealing with addiction, whether yourself or for a loved one. We want to provide you with a platform that you can come, ask questions, have conversations. Myself, Ben, and Tambini, we are active members in there, and and Dr. Z will be in that group as well. So if you have any mobility questions,
Absolutely.
you would get in there and ask Dr. Z, and he'll instruct you properly. Am I forgetting anything, Ben?
I think we got it all, Tom.
Go to realrecoverytalk.com/services if you would like to schedule a 1-hour call with either myself, Ben, or Dr. Tambini. The difference between the schedule call on the homepage, that's 10 minutes. We're just going to hear about what you got going on and give you some pointers. Go to realrecoverytalk.com/services and you can get a full 1 hour with any of us. Now, that obviously costs money, but it's well worth it. I look at it as an investment, Ben. Don't you?
I do.
All right. What's up, Doc?
What's going down? I'm just in awe. That was really impressive. And
Yeah.
I like the radio voice. It's everything's, I'm just really enamored.
Oh, thank you. Thank you. I've come a long way.
Absolutely. That was impressive.
So me and Dr. Z over here go way back.
That's right.
I'll give a brief introduction.
Yeah.
How did we even initially meet? I don't even know.
I think it was Mike.
Oh, Mikey.
Yeah. All right.
No, I just saw him actually not long
Yeah.
ago. He's a
He-
good dude. I
he
love
is.
Mike.
Yeah.
I think that's how we made the introduction. And Dr. Z, is that you go by that, right? Yeah.
Yeah, absolutely. It's easier. My last name is a mess, so we'll pass it.
Zabriskie.
Zabriskie.
Yeah. So anyways, I oftentimes have ailments with my body in some sort of joint or, plantar fasciitis or patellar tendonitis, shoulders, neck,
back.
Yeah. No, back's been pretty
All right,
good.
just kidding. Just throw that in there.
But Dr. Z is always my first call. And I go there and, he says, I need you to come probably 8 to 10 times. And I go there 4 or 5. and then
two times.
No, I went 4.
That's right.
I did go
That's
4
fair.
times.
That's fair.
And I start to see some results, and then I'm like, oh, I got this figured out. And then, so here we are.
The accuracy. Yeah.
No, but in all seriousness, I've known Jordan for a while now, just an all-around good human. And what I thought was going to be, and Ben, obviously you're going to speak into this after in direction, in terms of substance abuse, oftentimes how do people get hooked on opiates, Ben?
Injuries.
And opiates oftentimes are used as a quick fix.
Absolutely.
Right?
Yeah, or a cover up. Yeah.
Or a cover up, a Band-Aid.
Correct.
And you end up getting prescribed these opiates for said injury. Next thing you know, you're hooked on them, and it really blunts even the pain. So you can't. How would you explain that?
So essentially, what an opiate does is it will take place on where the receptor site goes and won't allow for certain neurotransmitters that would indicate pain go, and it does this cyclical thing. And for however the half-life of that drug lasts, the person feels nothing, and it's null and void. Until then, obviously, that wears off, and then any pain they had previously is either same or worse, because if it's blocked and you're taking your body through certain ranges of motion that the pain would stop you from, now you're going and doing all those things, and now that opiate is out of your system, and now you have increased inflammation, increased pain, and your system is worse. And then you take another opiate, repeat the cycle, and then eventually you run out of opiates, and then things can get really bad. And then at that point, a lot of times people have an addiction at that point, So,
Yeah. It's a nasty cycle.
Sure.
And the fact that people get on the opiates and then end up just taking more and more and more, right, to essentially elicit the same, result, All I want to do is be pain-free, be pain-free, be pain-free.
Correct.
Why I knew it would be good to have you on to talk about this is there's so many things that are at our disposal to be able to do that we're not doing.
100%.
And we just hinge on this pill.
And two, it sounds like right now we're kind of talking about prevention, educating on the fact that, hey, there's other methods beyond the pain pills, but also in the recovery process. One of the challenges that we face in our field is a lot of times you have somebody who legitimately has chronic pain.
Yes.
Like we discussed, they get hooked on something,
Sure.
But then they get sober and they're like, no, I need these pills back. How am I going to? But what we want to do on our end is introduce them into ways of how to, hey, let's get rid of these pills, try some holistic methods,
Sure.
and improve your quality of life overall. And not reintroduce the pain pills, because it's like a battle with addicts. They're like, I need it. You don't understand.
Of course.
And then on the other end of it, we see the results.
Well, because they look at it as their only solution. So if you feel that the only way is to make this pain stop, and for anybody out there that's been in pain, specifically chronic pain, and if it's severe and it's limiting your activities of daily living, or just, sleeping, going to work, whatever it might be, right? That really wears on you mentally. And at that point, no matter how you've worked your steps and everything you've done, you just want to make this pain stop. So for the people that are listening out there that have chronic pain, I want you to understand that there are other solutions. Okay. And most of it is just finding either a program or an individual to evaluate you to determine what is the cause of your pain. Yes, I understand maybe you have meniscus tear or a labral tear, or you have a lumbar disc situation, but there are ways that you can calm that pain down, mitigate that pain, and actually live a pain-free lifestyle, which is why I named our Instagram that. And you can circumvent the need of using opiates. Now, once you get out of pain, and we talked about this before, Ben, about how important exercise is as far as helping you get that endogenous opioid that's in your system as far as those beta endorphins are concerned, and which is why exercise is such a huge part of your programming. It is a huge part of my life because it's helped me from a mental standpoint and deal with the challenges of life and everything in that aspect.
For the listeners, if you're watching YouTube, my man over here looks like a Greek god. He is chiseled. So
Appreciate that.
he's not exaggerating. It's a part of his lifestyle.
The as far as the pain goes, one thing that I would like us to discuss a little bit is pain in and of itself, like so for instance, right now I'm having shoulder issues.
Sure.
What's your thoughts on like the body kind of overcompensates in different areas? So a lot of times people say, "Oh, I have back pain."
Right.
And they automatically assume that it's back issues.
Right.
When in fact it could be hips the whole way down.
Sure.
Or up to your shoulders.
Yeah, that is a fantastic point. So a big part of when I evaluate a patient or I talk to a person is that I educate them on the fact that let's use back pain because that's what most people have, okay? The majority of people that have back pain or even disc issues, it's not because of their back itself, it's because of the surrounding structures above or below. And so for anyone out there that's never heard this before, I'm going to give you, it's a really simple 20-second thing. There are areas of your body that are mobile joints and stable joints, okay? So for instance, your ankle is a mobile joint, your knee is a stable joint, your hips are mobile, your lumbar spine is stable, your thoracic spine is mobile, yada, yada, yada. And as you see, it flip-flops, okay? So if my hips lack mobility and my thoracic spine, that big structure in the middle of your body doesn't move properly, that means your lumbar spine or your pelvis has to have more movement than it's supposed to, okay? And so if I bend down to pick something up or I'm putting my shoes on or I'm working out in the gym, instead of having a stable back, it now has to move because my hips move poorly, because my T-spine moves poorly. And now all of a sudden I quote unquote slip a disc or my back locks up or I'm getting spasm or I have pain daily. So when I attack a person that has back pain, I generally start with their hips and their T-spine. And I get those things moving first. And then all of a sudden their lumbar spine doesn't hurt anymore. And so there's a misconception. Everybody focuses on where the pain is. And the same thing works for knees and tennis elbow and shoulders and those kinds of things. So we sit so much as a population, right? The average American sits anywhere from 8 to 9 hours a day. And then you're driving in your car and then you go home and then you sit when you watch TV. Okay. And nobody does anything for their mobility. They don't stretch. And they generally don't do that until then they have pain. And then at that point, they're so far behind. So they seek some kind of pain medication and something like that. And now that whole process, that whole, cascade of events that you were alluding to, Tom, happens. So if you can attack that problem prior to you having greater issues, then you can avoid this whole pandemic in the first place.
Yeah. I mean, my wife is an example of this. I mean, there's not a day that goes by where she's not laying on the heating pad.
Yeah.
And it's like, it was interesting too, because she has lower back pain. Mm-hmm. And I never really realized, and I think it was when I was at your office a month ago or so. Mm-hmm. And I saw probably 3 middle-aged ladies there. And I think they all had back pain.
Sure.
And every one of them, you were working on their hips.
Yes.
What is it about it? Like the muscle and everything in there just locks up or what?
So I try to think of a good analogy, right? And it's not perfect, but think about a car, okay? And you have the steering mechanism and the axle. Let's just say you have an independent axle that moves. If for some reason that's locked and I'm trying to turn, the frame of the car is going to get a ton of stress and it's going to shift and move. It's not supposed to. It's supposed to be a solid, stable structure, okay? Your pelvis, your lumbar spine, where most people have pain, their SI joint, etc., it of course moves because it's a joint, but it's not supposed to have a ton of translation, okay? So if on a daily basis, You bend down, you flex, you get out of a chair, you get in and out of a car, you put your shoes on, you pick up your child. That all requires movement in your hips. And if your hips move poorly, or your hamstrings are tight, or your glutes are tight, or your paraspinals are tight, then something has to give. And so your body will make movement, make your pelvis have, I guess, excess movement. And then all of a sudden your back slips and now you can't get off the ground, or you have to use heat, or you can't walk the next day, or whatever that might be. And that is what causes this whole cycle. And then someone gets an MRI and the MRI says that they have herniations. And the orthopedic says, well, this is the cause of your pain, right? But the reality is, I would say 80% or more people walking around have herniated discs or disc bulges or disc extrusions. And that's not the pain generator. Generally, it's your facets. Generally, it's your SI joint. It might even just be your paraspinals or your QL, any of those muscles that surround. And so if you take a pill or you get an injection or even chiropractic adjustments at that point, right? Which there's nothing wrong with that. But if you don't correct the source of the problem, then the same thing is just going to happen again and again and again until eventually it gets worse. And then people go to surgery or more pain medication or more opiates and those types of things. So I don't know if that makes sense.
Yeah. The interesting thing, Ben, do you have anything yet up to this point?
Yeah, go ahead though.
The chiropractic side of it, people are so quick to, there's like the rack and crack people.
Yeah.
I've met so many people that live and die by going to the chiropractor.
Sure.
And, I'm going to reference my wife again.
Yeah.
She went to a chiropractor not long ago.
Sure.
Got adjusted.
Sure.
Next day she couldn't move. And I'm like, and I love chiropractic. I think that it's an amazing thing. If the person knows what they're doing, and I'm not even saying that this person doesn't know what he's doing.
Mm-hmm.
But it's just like finding the root, and understanding that anybody can go to a chiropractor, and being the chiropractor, of course that's your livelihood.
Mm-hmm.
You want people to feel like, hey, I can fix you. And, it ended up doing her more harm than good. And it was frustrating.
Well, it's not that an adjustment in itself can be the negative thing. It's diagnosing the person for what is the cause of their actual problem, right? So adjustments can be one of the best things if you throw your back out or you have a SI joint dysfunction or what a chiropractor would say is a subluxation, right? But if a person is too acute or you're adjusting something that isn't necessarily the cause, then it could aggravate a person. I don't know if it would hurt them necessarily, but you could definitely cause more inflammation and more issues. So it depends on the person that is applying that treatment. But again, at our office, adjustments are part of the thing that we do, right? So let's assess what's the cause of your problem. How did you get here? Did you pick up something too heavy? Was it gradual? Did this happen over time? Did you just bend down to pick up your son and all of a sudden your back hurts? Do you really think your 20-pound son is the reason why your back just exploded? Probably not. You've done it a million times before. Why this time? And that's the thing that people don't realize, right? You think putting on your shoes is the dangerous thing? People wake up with neck pain. You think sleeping's dangerous? It's not. What you don't realize is most pain is an accumulation of poor movement patterns over a period of time. So you sit, you go to sleep, maybe you work out, but you don't stretch, you go back to sleep, you wake up, you do it again. Each day, you get less and less movement, less mobility, what I call in our office fascial restrictions. So there's a connective tissue that surrounds your body called fascia, okay? And fascia is a totally normal thing, so don't think that, something's wrong with you. Fascia is like a net. Your muscles, tendons, ligaments, joints are like fish, okay? So you have a certain size net and all those things move freely. And over time, every movement, like you sitting every day, working out, if there's an accident, that net tears and it shrinks some. That's a normal process. Now, if you were to stretch every day, if you were to foam roll, if you were to move intentionally, then you can maintain the proper length of that net. If you don't, it compresses. And now all of a sudden, each day you wake up, I feel more stiff, right? Think about when you were 18 and think about when you're 40 or 35 or 50 or whatever it is. Do you think that's just because of age? It's not. There's some 50, 60, 70-year-olds, my mom, that wakes up, she springs out of bed. Is it genetics? Maybe. Is it a lack of intentional movement every day? Probably. Do some of you have terrible traumatic injuries? Absolutely. Okay. So it's not the same for every person, but I promise you, if you do not do something every day intentionally to move, you will get worse over time, because it's like a law of matter. Okay. That net will get more constricted every single day that you don't. And that causes compression of a joint, which can lead to back pain or neck pain or plantar fasciitis or knee pain or meniscus tears or whatever those things. So that sounds really simplistic. And obviously there's levels to it, but that really is it in a nutshell.
This is very convicting up to this point.
Yeah, it's very palatable. I like the way that you put it because it's easy to wrap my mind around.
Because that's it. And that's exactly how I explain it to people. Because again, if my patients aren't on board, if they don't understand what we're trying to do, because this is a teamwork thing, that's what I tell them. We're on a team, okay? I'm going to help you, but if I'm not educating you on how to get better, you're not going to get better. Like, yes, I can work on you. Yes, I can adjust you. Yes, I can do active release and you'll feel better temporarily. Maybe it's gone, let's just say, right? Miraculously, you have no pain. Then that's awesome. But you're going to go back to your poor movement patterns. You're going to go back to sitting on your couch. You're going to go back to sleeping poorly. And now eventually it's going to come back either the same or worse. And I haven't done my job. So I think ultimately that's the biggest issue. Whether you're taking opiates, you're getting adjustments, you're doing dry needling, you get an epidural. If you don't change the things that have got you there, it's going to be the same thing.
That's one of the things that, there's so many avenues now. And I know, Ben, we're going to pivot to addiction here in a second.
No,
but I like this. This is good.
Yeah.
It's out of the box for us, right? But it all ties in. What I was going to say is, you see all these like trends, right? The dry needling, the acupuncture, the cold plunge, the cupping, the this, the that, the cortisone shots.
Don't get me started on cupping.
Yeah. What does that do other than give you massive hickeys?
Okay. Cupping, I think, has application if you use it, and this is my own personal opinion, if you use it with movement, right? Because it goes back to fascial trains. Mm-hmm. So fascia is something that's on from the top of your head to the bottom of your foot. It's on every single person. And I apologize for people that are food conscious, but if you've ever had meat, okay, and that thin layer of tissue, not skin, that is fascia. It is on all animals, okay? It's normal, okay?
It's on the backside of a rack of ribs.
Correct.
Always have.
Yep. Right.
Yeah.
That's fascia,
yeah.
Okay? And so if you're not manipulating that way to create more movement, then you're just going to get compressed over time, right? So, it's one of those things where I think people want the quickest fix.
Yeah.
Like, how can I get better right away? I think the thing with cupping, I got off topic, but the thing with cupping is it looks like you've done a lot. It looks like everyone shows their back. They're like, look at my back. And it looks painful, but it's not.
That's true.
It reminds me of like when I was like, I think I was 11 or maybe it was 10. Yeah, 10 or 11. I was like in 6th grade and I had a girlfriend who was in 8th grade and I was very intimidated. And, we're hanging out. She's my girlfriend, whatever. She's like, I'm going to give you hickeys. And I was like, I didn't know what that was. And I was like, yeah, awesome. Let's do that. And then so She gave me a ring of hickeys around my neck, right? And at the time, I'm like, this feels great. Like, I feel good. And then I went home and my mom's like, what did you do to yourself? And I look ridiculous. I had to wear a turtleneck for like, in like summer for like a week.
That's awesome.
So that's every time when I see people with cupping. But in all seriousness, if you use cupping in conjunction with movement, I think it's really helpful because it does bring blood flow to the area. It does facilitate movement and fascial movement and those types of things. But if someone just puts cupping and you just lay there for an hour, I don't know that it's going to change much, right? So that's.
What's your thoughts on the I've seen this trend now where people are doing blood flow restriction.
It works.
Does it?
Yeah. BFR.
Yeah.
So essentially BFR, blood flow restriction, is where you use a cuff on a segment. And so essentially I use it with patients that have, they're healing from a knee surgery or shoulder surgery or something. You can use less weight, less force by restricting blood flow to the area because you're causing more of a demand. So you cause more demand on the tissue and you can then inherently use less weight. So it's less stress on the joint or less stress on the injured tissue.
Okay.
Yeah.
I always thought that was goofy, but what do I know?
So I think an important part, since you brought up cold plunging, and for anybody I know I have my adamant, cold plungers. I'm not going to say anything negative about your cold plunging. I just think it's important to note that if you're doing strength training, okay, you should cold plunge 4 hours before or 4 hours after.
Interesting. Why?
Because if you think about it logically, if I'm tearing down tissue, the last thing I want to do is restrict blood flow to that area, right? I want it to grow. I don't want to. So cold in itself causes vasoconstriction of arteries and everything else, right? And it reduces lymph flow and all this stuff. So when you are in the gym and you're throwing around squats and deadlifts, or you're doing CrossFit or whatever you're doing, or for my Globo gym meatheads like myself, I love throwing around weight, right? But the last thing you want to do is ice after. You don't want to do that. So you wait 4 hours, get your meals in, stretch, mobilize, and then 4 hours later, do your cold tub, right? And Huberman says, 11 minutes a week is sufficient. 12 to 11 to whatever, 13. And there's a tremendous amount of benefits with cold tubs. I just think people get the misconception that they should do this rigorous weightlifting movement and then do the cold tub. Now, if you're doing cardio, I don't think that it applies quite the same. So you're running, you did a marathon, you have practice, right? So like back when I played football, we do cold tubs after practice. I don't have any issue with that. It's just as far as, strenuous weightlifting.
Yeah, that makes perfect sense with the cold plunge thing. The other thing I wanted to touch on too is, again, the way that you present everything. And what I was picking up on earlier is that you're not just adjusting people, you're educating them. Yes. And it's the same thing with what we do. Like, I can have all the knowledge in the world about addiction,
sure,
but if I'm not able to communicate it in an effective way, and just to be very straightforward, like, you've gotten very effective at communicating this.
Thanks.
And like you were speaking with me earlier before we hit record, I was talking about my lower back pain, and I kind of threw in the towel. I'm like, oh, it's going to be hurting forever. I'm never going to be able to squat again. So I'm avoiding all these certain movements. And we went over a list of them. And you brought up a good point that, like, I think now I have the mindset of, like, these are the things I can do. But then you were saying, like, over the course of time, it's going to become more and more restricted.
Exactly.
Because I'm sticking to that pattern. How did you put it earlier? It was well said.
I don't remember exactly, but it is human nature to avoid things that are going to be aggravating, right? So if I hurt my back and bending down hurt my back, then I just, I can't tell you how many, I don't want to say thousands, but hundreds and hundreds of people that come into back pain. and I'm just trying to do an evaluation. I asked them to bend forward. They're like, oh, I can't bend forward. I'm like, well, for how long? And they're like, well, I don't know, 10 years. I'm like, you haven't bent down for 10 years? They're like, well, I can't do it because I'll throw my back out. And I'm like, you're 35, man. You know, like you think things get easier with time? So what my point is avoiding movements. Obviously, when you first have an injury, I understand, right? It's an acute problem. It's super bad. But if you keep taking movements away from you, you're just going to become more and more restrictive, and your limitations are going to be such where you're not going to be able to do any of the things that you want to do, right? So, you know, I think educating, and just like you're saying, educating a person, explaining it to a person so that they understand, as Einstein says, if you can't explain it to a 4-year-old, then you don't understand it well enough, right? Using big medical jargon and throwing words around and just confusing a person, scare tactics and all those types of things, that's not going to get it done. That's not how I want to do things. I don't want you to make you feel like you're going to die. I want you to feel like I want to empower you. You can make a change. And I'm telling you, anyone listening out there that you have pain every single day, I promise you can make a change. Now, is everybody the same? No. Do you have to find out what your limitations are and how you can progress? Absolutely. But if you're walking right now and you can get up out of a chair and you have all your faculties, you can make a change. Okay? So it's just finding the right vector, the right avenue, the right person, or whatever plan to progress you to what your goal is. But pills are not the answer, okay? And yes, epidurals are helpful if you have severe radiculopathy and those types of things.
Is that a real thing, radiculopathy, or did you make that up?
Just made that up. I just like to use fake words.
Okay.
I just like to throw around random medical words. No, radiculopathy is sciatica, right?
Okay.
Oh, that is a real
It's a real word. It's real, yeah.
Okay.
Yeah, so radiculopathy essentially is if you have pain down the back of your leg, right? Burning pain, or you have drop foot, or you have numbness in your hand and it comes from your neck all the way down, that is called a cervical radiculopathy. If it goes into your leg, then it's called a lumbar radiculopathy. Now, there's levels to it. What's the cause of it? It can be caused by a disc. It can be caused by nerve entrapment. It can be caused by piriformis syndrome, right? So that's why getting to a person who can accurately diagnose you, that's really crucial. Unfortunately, in today's world, doctors just kind of get you in and out, right? You got 2 minutes. They look at your scans. Yeah, you got an extrusion, blah, blah, blah. Do this. If they listen to a person's story, much like I'm sure you guys do when you evaluate clients, you can really determine how they got here. That's how you fix stuff. So for anyone out there that has pain and you're trying to figure out how you got here, go through what you do on a daily basis. How often do you sit? How often do you stretch? When was the last time you've done anything, any type of intentional movement? If you just wake up, you brush your teeth, you eat breakfast, most people don't, right? You get in your car, you go to work, you come back, you sit on your couch, you go to sleep, you do that again. I promise you that you're part of the problem, okay? And I mean that in a loving way, but you need to do something that your body is going to appreciate, that you can move every day. Movement is medicine. People say that all the time. I'm very much behind that. And as a person who has herniated discs, I have meniscus tears, I have labral tears, I've separated my shoulder. I've played a lot of sports. I've done a lot of falling off motorcycles. I've had a million concussions. I have no sense of smell because of that. So that's fun. At least I have my memory. Yeah, fun fact. So I'm not saying don't live your life. I still like to go throw a weight around. I like to lift 600-700 pounds for no reason. I'm not in a contest. I just have a sickness. I like to do that. But I make sure that my body is able to move so that I can do that and that I can mitigate my pain. So it's not that pain doesn't happen. It's how do you mitigate that pain? How do you circumvent that? And so that you can get past it and do all the things that you want to do in this life. Go ahead.
I was going to say, are you good? Okay. You don't have to leave?
Oh, yeah. No, I don't have to leave.
Okay.
Yeah.
Tying this into the addiction thing, one thing that you said, and I can't say it verbatim, but you just said it again. We want you to be able to do all the things.
Correct.
Right? You know, I got 3 kids. I want to be able to go and throw the football with my son, roll around, do all the things, blah, blah, blah. Tying this into a sobriety sense and an addiction conversation now.
Sure.
That's a lot of what we're doing when getting people clean and sober.
Mm-hmm.
It's not that we don't want you to be able to go to a restaurant that serves alcohol but you can't go there because they have a bar there and they have, they're serving liquor and all the things. And like, we want you to be able to go to the concerts and even the festivals. Like, people go to festivals that are sober and all the things. But there's a process in which you have to get there, and it is just the same as movement, and your pain is derived from something else. Your addiction is derived from something else. Most of the time, unrealized trauma, in a mental, emotional, maybe spiritual sense, figuring out what those are, and then, buttoning those up. And then as time goes on, you work the steps, you do all the things, and then you slowly get to this point where you can do all the things that you used to be able to do, just minus drugs and alcohol.
Yeah, since you started touching on the drugs and alcohol again, I want to go to your experience with that.
Sure.
So if we were on like our history, we didn't talk about it, but I met you over a decade ago now.
Absolutely.
At a place called Unity. It's the first place I ever worked in substance abuse. I was a tech there, and you were doing your work there. So you've been working with alcoholics and drug addicts for, as far as I know, over a decade at this point.
Yeah. Doing
what you do. From your perspective and experience, what have you seen as far as benefits? Is there anything that you think is notable that should be pointed out and discussed?
What I would say is, and I got into working with treatment centers and addiction because of my own family experience. I have an uncle who has been on and off using for over 40 years, 50 years. And I mean, and the man's a genius, and he's unfortunately he's ended up in jail, for a whole situation that he could have easily avoided, but it's tragic. And fortunately, it got him clean for a little while, but he's relapsed, and there's this whole thing that I've seen. And then friends that have passed away from overdose, right? And friends that have thrown their life away, unfortunately, either with accidents or DUIs or whatever it is. And, so I've always wanted to help this community and be a part of it because of those connections. And what I've seen, the people that do the best, right, are people that make a conscious change of exercise and making that a huge part of their life. And I feel that exercise is the closest thing that you can do that will replace that feeling. And as I said before, it's that endogenous opioid that is inside your body, that beta endorphin. But also, it's really hard if you're involved in a fitness lifestyle to want to get high and then also be fit at the same time, because they're polar opposites of each other, right? It's going to be really difficult to do both things. And the more consistent you are with your exercise, it does a couple things. It helps your confidence. It helps when you keep that promise to yourself, it boosts your self-esteem from a mental clarity standpoint. It also helps reduce pain. And these are all things that opiates do, except this is natural, right? And it's that 21-90 thing, right? So 21 days to make something a habit, 90 days to make a lifestyle change, right? So for anyone out there that's just struggling, they can't do it. If you do it for 21 days, it's now become a habit. If you do it for 90 days, now it's part of your lifestyle. And if you just make that promise to yourself. And I've said this before in different places, but in a world where there's so much that is out of our control, right? For me, the gym is something that I can control every day, and exercising. I can control this. It is a promise. It is my standard to myself that I'm keeping. And then everything after that is predicated from there, right? Everything else I do in my life, my work life, my promises to my family, to relationships and friends and all those things. And maybe that sounds, overdone, but really it's that simple, because if you can keep that promise, then you know that you can keep promises to everything else, and you're going to feel better. Your pain will be less. Your addictions for craving, in my opinion, from the patients that I've seen, is less. And I don't know. I just think it's tremendous. I just think it's understated on how powerful exercise is, and just being out of pain. Truly.
That's one of the biggest things that Ben and I have talked about a lot on the podcast, is you see people that put down the drink and the drug, but
Right.
they change nothing else about themselves.
Right.
And oftentimes even amplifies, right? Because it goes back to, are we addressing the core issues? If we're not addressing the core issues and we just put down the drink and the drug, it's going to come out sideways in some other way.
Right.
Through food, through pornography, through shopping, whatever the case is. And being able to incorporate. So what I was getting at though, is you see people, they put down the drink and the drug, but then they're smoking 3 packs of cigarettes a day,
Sure.
drinking massive amounts of coffee, eating absolute total trash all day long. And it's like, well, why'd you bother getting sober to begin with?
Well, they're still trying to fill that void,
Right.
that dopamine fix.
Yeah.
Or they're trying to overcome depression, right? Or a lack of self-worth. We all have these issues, right? We all have battled depression, especially guys. Guys don't talk about that, right? And I myself, I've battled it, and not to go, but Suicide Awareness Month, that was September, and I spoke on that on my Instagram, and my own experience. And then, I've lost 4 friends to suicide, right? And I know that's a huge part of people that are battling addiction. Like they struggle every day. They're depressed, and then they want to hide or cover that depression with their drug. And what I'm saying is, through all the terrible things that I've been in my life, the gym or exercise has always been something that has pulled me out of that. And it's helped my, battle my own demons and those types of things. So, it's just one of those things that, just like you're saying, Tom, is that you've got off the booze and you've got off drugs, and now you've interjected food or cigarette smoking or coffee or pornography, right? And so now it's another bad cycle, and it might only be a matter of time before you get off the horse, right?
Yeah.
Yeah.
Yeah. And I think people look at, well, you need food to live,
Yeah.
and it's like, well, yeah, you do, but you don't need McDonald's every day. And I don't eat McDonald's every day.
That's good.
I have my own struggles with food, but I do not eat much fast food.
All right.
I made a reel on our Instagram the other day talking about, because a lot of times we'll get clients here and we know the benefits of exercise. But my point was, in making this reel, was like, think back to, people will tell me, I'm like, why don't you start working out? Why don't you come out to my workout? We'll get you started. Oh, maybe in a week or 2. I'm not feeling motivated right now. I'm not feeling good.
Yeah.
My point is when I would wake up dope sick, not have a penny to my name, not a pot to piss in, and somehow I managed to get myself up out of bed and go get my fix, get whatever resources I needed. Like, that hustle was there.
Sure.
And then we get sober and we're like, I don't. So to Tom's point, like, why'd we get sober? I got sober because I didn't want to go through that anymore.
Sure.
Right. But I can still apply some of those experiences and some of that drive. Like, reflect back on the drive that we had as drug addicts to get what we needed to get.
Yeah.
I knew I needed that bag of heroin no matter what. And it didn't matter. I remember driving through blizzards in Minnesota. The roads were closed. You name it. I figured it out.
Right.
Hurricanes. A hurricane would come through. I'd be going up into Riviera Beach when the place is wiped out, like trying to find my dope dealer. Like, did whatever it took. And so that drive and ability is there.
Absolutely.
We just need to apply it.
Well, and again, it's going back to what I'm saying. Like, keep that promise to yourself, right? If you make that your focus, because I don't feel like working out every day. It's not something that you always feel like doing. But there's never a time that I've gone and worked out and exercised, or anybody out there that I felt worse when I was done.
Let me say this, because this ties into something else I want to talk about. I appreciate you saying I don't feel like working out every day.
Yeah.
Because look, as an outsider looking in, like when I see you on Instagram or Facebook or whatever, I'm like, this dude loves working out.
Yeah.
He wants to go every single day.
Yeah.
He's got a successful practice. Like, dude, you look like from the outside, like this man has it together.
I appreciate that.
But I appreciate the fact too that you're coming on here and like being open about you discuss the depression.
Yeah.
Things along those lines. Like, we have a tendency to look at others. I'm guilty of this. I look at other people and I'm like, oh, if I only had the mindset they had, if I only had the ability that they had, not realizing that every single as I get older, I'm realizing everybody struggles. Everybody. I grew up, and this is where my lack of self-esteem came in as a kid.
Mm-hmm.
I thought everybody else had it together.
No, they don't.
At all. What I'm realizing as I get older is in some way, shape, or form, everybody's lost.
Everybody's lost and has messed up plenty. And I get that a lot, which is why I do talk about it, because I do get that. I mean, our social media has grown, okay? And fair or not, people put you on a pedestal sometimes when you have a high following. And it, to me, it doesn't mean anything. I'm the same as everybody else. I don't elevate myself. I'm a firm believer that you treat other people like you want to be treated, okay? Have respect for yourself, have confidence, but don't be prideful. Don't put yourself over other people, because you really don't know what you're going through. I told a story the other day about this guy, Bob, that I saw in the gym 4 years ago. Okay. And Bob, when I first saw him, he had a dress pants on, dress shoes, and he had a, undershirt on. So this man's clearly working out in his business attire, but he's in the gym. So I'd seen him once or twice. So I went up and there's these kids behind him making fun of him. And I could see he looked really uncomfortable. So I went up to Bob. I said, hey, Bob, I like your outfit today. Just kind of joking, trying to make him feel comfortable. And he's like, oh, Jordan. He's like, man, I sat in my car for 30 minutes. I didn't want to come in today, but I made a promise to my girls because my wife just died of a heart attack.
Oh, shit.
I have 2 twin girls at home. At this time, Bob was 380 pounds, roughly, just under 400 pounds.
Mm-hmm.
Okay. And I saw this man. Oh, so he said I had to keep my promise to my girls. So I came in and I worked out. I saw this man about a year ago. So 3 years later, and he lost 200 pounds. So in my thing, I said, if you ever are lacking motivation, think about Bob. I said, be like Bob. Okay. Here's a man that made it bigger than how you feel. He did it because he found purpose. So if you're out there and you want to really get sober, make a promise to yourself to make health and fitness part of your life. And I promise you won't regret it, because it will change your life. It will keep you sober because you're going to put value into something greater than how you feel, because you're never going to feel like doing it all the time. So there's a difference between motivation and discipline, right? I'm a big person on motivation. Motivation is what gets you going, and discipline is what keeps you going, right? Discipline is doing the things that you need to do when you don't want to do them. Motivation is doing stuff because, well, I feel like doing this right now. And that gets you started, and that's awesome. I can listen to Tony Robbins, David Goggins gets me fired up, right? But he doesn't do all this because he feels like running 100 miles. He does that with any kind of sanity. He does it because he wants to prove that his mind is stronger than his body, right? And he wants to motivate other people. He wants to help other people. That's why he does those things, right? And so for me, I love the gym community, but again, like it saved my life. And I mean that. You know, I've battled depression since I was 16, 17 years old. True story. I walked to the end of the top of the YMCA building, right? 17. And granted, I'm captain on the football team, right? I got, I don't know, I guess in my opinion, the most attractive girlfriend in high school. So things on the outside look really good, right? And I'm sitting at the cool, quote unquote, cool table at school and all those things. But I was really hard on myself. I never was good enough for anybody in my mind, right? And so much so that if I didn't look a certain way, I'd eat my lunch in the bathroom, okay? And I remember it was Friday, we didn't have a football game. And I walked to the top of this YMCA. It's about 7 stories up on the other side. And I'm about to jump off, right? And I see an image of my mom crying over my body. It's a true story, right? And I don't know what that was, a premonition, I don't know. But it made me sit down, and I sat and I realized how selfish I was being and how I wasn't even grateful for all the things that I have, right? And especially for people who are battling addiction or people who are battling depression, if you just look at your situation, you take a step back and you look at all the things that you can be grateful for and just hold on to that. And that's your why for moving forward. But you're going to need some help. And for me, the gym was that, or eating better, or whatever it is, or working your steps, or whatever it is. But don't make it that it's something you do just because you feel like it. Do it because it's something that you've made a promise to yourself. And then you can just, it becomes easier because now it's automatic. It's a part of your lifestyle. It's not something you have to think about. I know, Ben, I know there's days you don't feel like doing it, but when you're done and you've exercised, you always feel better, right? So that's why I have such a conviction for it, because I've seen it help people battling addiction. I know it helps people with mental illness like myself. So there's so many different levels to this that that's why I preach it to people all the time.
Wow.
Yeah.
Dude, I thank you for sharing that. And I mean, just to call it what it is, that's being vulnerable. And since you went there, I'll briefly touch on it. Same experience with me. I battled depression my whole life. I'm very open about it.
Sure.
I tell our clients, like, I'll bring it up in group, and it's something that affects me today even. Quite a bit some days. Like some days I'm just, oh, dude.
Yeah.
Come on, man. Why'd I have to wake up today?
Mm-hmm.
But the suicidal ideation thing through high school, same thing here,
Sure.
And I've had experiences with that throughout my life, to be honest. But kind of what you were touching on too, you talked about your mom and you saw this image.
Yeah.
And the thing that I want to touch on is like something that's really helped me, because I'm always like, look, if we bring this stuff up, I want to kind of touch on solution. Everything that you said was beautiful. Like that's what you shared as part of the solution.
Thanks.
But one thing that I've noticed for myself too, that I love sharing about my experience is, like, now that I'm sober, I have people that are counting on me, right? Like it's not easy to say, okay, I'm going to check out today. This is the day I'm doing it, right? Like I'm ending my life. What about my kids, man? What about my coworkers? What about the clients here?
Mm-hmm.
Like, and the vulnerability and sharing on that, you talked about purpose.
Mm-hmm.
Like, dude, I believe from the bottom of my heart, so much of the time it's the people that go through the most pain, even on a daily basis, are some of the best people that contribute to the world.
Sure.
On a human level, we're a bunch of spiritual beings having a human experience. Like,
Yeah.
going back to everybody struggles. And we were talking with a young lady yesterday and it was me and Eric that we work with, the guy with the mohawk that's on a bunch of our reels and stuff. But we were basically, Eric looked at this girl and said, "It's okay. I know you're in pain right now." And this girl prior to was going off on him. like screaming at him,
Sure.
cursing at him, and and Eric's pretty intimidated looking. He's an MMA fighter, and just, I know you're in pain right now,
Sure.
in a very gentle voice, and like people connect through pain.
Yeah.
Right? More so than anything else, I believe.
Mm-hmm.
Like, you don't really even, it takes me, when I sit down with alcoholics and addicts, just a matter of minutes when they're explaining their situation. And like, I'm like, don't worry, I speak your language. And you give them a little bit of the backstory, and it's just enough where they're like, this guy gets it.
Yeah.
Right? But if we're not authentic, vulnerable, open like that, man, I look at it like a superpower.
I'm grateful for the things that I've been through. And I say that all the time because I think it is super common, specifically in today's world, because you compare yourself to everybody else on Instagram and Facebook or Twitter or whatever, and everybody puts their highlight reel, okay? And that's BS, right? That's not real life. That's not how that works. Everybody struggles. I don't care how perfect their life looks, And I'm grateful for the things that I've gone through, because it makes me appreciate where I am. I'm still alive another day. I'm grateful for the food I have on my plate and the roof over my head, because there's times in my life when I've been broke and I didn't have any of those things. And so, a great quote that I've read recently is, if you don't appreciate, the things in your life, imagine all of that taken away right now, right? Because people are like, I hate my job, I don't like my clothes. The sandwich I had, whatever, at Jimmy John's was trash, right? And whatever. And I'm like, okay. Or my car broke down, or I got a flat tire, right? I spilled something on my pants. And it's the worst day ever, as these kids say, literally, on God. But you got a car in the first place, and I think only, whatever it is, 16% of the world has a car. I'm not sure exactly. You're wearing pants, so you have clothing. You're able to afford food, even though it was a bad sandwich. You maybe have a leak in your roof, but you have a roof. If someone took all of those things away, I bet you would give anything to go back to that worst day ever, right? Mm-hmm. And no, you don't want to put everything into one extreme or the other. But if you take a step back, you realize that there's so much to be grateful for. And comparing yourself to everybody, as they say, comparison is the thief of joy, right? Now, sometimes comparison puts your life in perspective, because there are people that have it so hard, right? And who are so grateful to be alive.
Yeah.
They're paraplegic, or this girl I met, at the hospital when I was visiting a friend. I think she was 14 at the time. She's smiling every day. I visited her maybe 2 or 3 times, right? And, she was in this other part of the unit, but I would always see her for some reason. She's always smiling. And I asked the nurses about her. I couldn't actually talk to her. And this is a girl that has, every time I saw her, she's smiling. Like the prettiest, most beautiful smile. She was bald. She has terminal cancer, right? She's going to die. And this girl looks like every day is the best day. So her perspective is just being appreciative to wake up another day. So it's just, you can go on and talk about this in a million different levels, but the point is that you never know what somebody is going through. You don't know the struggles they've had. Being kind to other people is going to make you feel better. You're going to help that individual. It's just, life is already pretty challenging. So, hardship, like you said, Ben, and all the things you've been through is like a superpower. I think that having an intimate understanding of what other people are going through is pretty powerful.
Yeah, man. I look at it like, when I was in the depth of my addiction, I'm like cursing God. Like, why?
Sure.
Why? But today, to be able to, for me, to be able to relate on so many levels to so many different addicts, like even amongst like the different drug scenes I was in, because there's various ones, or
Sure.
I know the heroin scene and fentanyl scene. I know the rave scene, like, or whether it's sexual trauma, suicidal ideation, depression, like, it's just stacked. And I'm like, why? But now, like, going back to like the superpower thing, like, it's literally an avenue for me to connect with so many different people. It's a beautiful thing.
Okay, so like I said, I ran into a family emergency. I actually had to bolt out. It was a pretty big emergency. Sorry we had to cut this episode short, but like I said, we were at the end. If you would like to contact Dr. Jordan in any capacity, you could find him on Instagram at Pain Free Lifestyle. Again, it's Pain Free Lifestyle. He has a practice here in Jupiter, Florida, but just a phenomenal person, and he can help you diagnose any sort of movement issues that you're having, any pain, any imbalances, stuff like that. He's a great guy. I've been working with him for a long time. I really hope that you enjoyed this episode. I know it's kind of out of the norm, but pain causes a lot of people to undertake medications, and a lot of times opiates are given for that. So I wanted to bring him on, and honestly, we're going to have him on again because there's just so much stuff that we can cover. And I really enjoy these types of conversations. So I hope you enjoyed it too. And again, it's content that's out of the norm for us. So that's it for this episode of Real Recovery Talk. Thank you for tuning in. In the end, if you have any comments, questions, or concerns, you could always reach us, info@realrecoverytalk.com. Again, that's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message. That is it. We will see y'all later.